Okay, here we go. Hello, All-Star clients, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while also having some fun along the way.
Okay. Wow, that was brisk and to the point. Okay.
There you go.
On today's episode, we have myself, co-host and associate veterinarian Dr. Ashlyn Duckwall, associate veterinarian Dr. Lauren Schmoke, so sorry, visiting veterinary student Emily Gallup, woo, a new person, and my lovely co-host and head veterinarian Dr. Emily King.
Okay.
Okay.
Yeah.
TikTok.
Yeah. Raise the roof.
It's going well.
It's going well. Yeah, it's going really well. Harrison has, figured out how to.
The algorithm.
Yeah. And
or something.
Something like that.
Something techie.
Metrics. I don't know.
But he said like 500,000 views.
In 3 weeks.
In 3 weeks.
Wow.
Yeah.
Awesome.
So it's been kind of labeled like educational, the TikTok stuff, because like they're showing like educational stuff. Yeah.
People don't see the ins and outs unless we show them.
And how to do stuff, which is cool. They're doing some really cool how-to videos, like which I think are really helpful because they put like put the description in like of the pictures and so which I think is really cool too.
Yeah. I think it's cool.
So thanks for all the people following.
I know.
Shout
out to the followers.
I know, right?
We wouldn't be here without you.
I never really even thought it was going to be that crazy. So, but it's good.
I know. And I feel like different social media platforms have different responses. Like, I don't know. Just TikTok has boomed, I guess. And I don't have any other ones, or I have Instagram. I don't have TikTok, but that's like not really a thing, I guess.
So yeah, if you're out there, go to TikTok.
Go TikTok.
Follow it. You will learn
a
lot.
Yep.
So that's pretty cool. Very good. Good job, Harrison. Way to go. How are you guys doing today?
Yeah. Good.
Just good. Usually at this point we talk about how hungry we are.
Yep.
Yeah.
Because at the end of the day we're all like, we're so hungry.
Yeah.
I think we should have food provided for the podcast.
That's
Harrison. He's never allowed us to eat on the podcast because of the
sound.
Because the sound.
The sound, no.
Yeah.
That might not be good.
We have a lot of rules behind the scenes.
I'll be honest,
we sure do.
I'm already thinking about if I'm getting food before my 30-minute drive home or
you're waiting till you get home and then eat.
what I
want to get it. Along the lines.
I have stuff at home, but I'm like, I shouldn't pay for food, but also it'd be quicker.
Yeah.
I'd get it now.
You get it now. It'd be something you really want.
Yeah. Something unhealthy, which sounds good.
Yeah.
Of course.
I don't know what I'm having. What's Charles making?
You're funny.
Bring the beer to
We literally have no food that we went out to dinner last night. We were struggling for finding meals and it was our anniversary last night.
Oh, congratulations.
Congrats.
Oh my gosh.
We
That's so
made
exciting. Looks like we made it. Okay, that's awesome.
What are you making?
I had last night poor man's spaghetti, so I'm probably having poor man's spaghetti again tonight.
What is poor man's spaghetti?
Poor man's spaghetti is like you just cook some noodles and throw some sauce on top of it.
Is that not normal?
normal.
No,
Yeah.
that is how Duckwall eats.
Yeah.
People. That is not normal spaghetti.
So what's your fancy spaghetti?
It is like meatballs on the Traeger. Harrison, vouch for them. Yep, they are super good. But you have, it's like 10 ingredients and the meatballs, and then you got to cook them on the Traeger, and then you got to put them in the sauce.
I don't know what a Traeger is.
Oh,
yeah, I don't
Emily.
either, honestly.
And so then you make the sauce with the meatballs, and it is really good.
My mouth is watering. That sounds delicious.
Yeah, it's really good.
Sounds good.
So anyway, Schmoke, what are you having?
My husband cooks, so
what's he making for you tonight?
Know.
Do you know?
I don't know. I get home and usually it's like in the works.
Well, there you go.
Wow.
Something to come home to.
Yeah.
Shout out
really
to
Connor.
Connor
the cook.
He likes it. Thank God. 'Cause, yeah.
As long as he's not out playing golf.
Yeah, he sneaks that in. And volleyball now. Yeah, it's always something.
So
but
active. Wow.
Good so there's that. Okay. Anyway, so we did talk about food in the end.
Yeah.
Okay. All right. So, guys, we're on to would you rather question. Would you rather have a full day of surgery or a full day of appointments?
That's a really good question. Why are you laughing?
I know the answer to that. Everyone knows the answer to that.
What?
You'd rather have a full day of Well, I guess it would depend on what kind of surgery.
I was going to say that's what it is. I didn't think it was that easy.
Okay. Well, what is your answer?
I like surgery.
No.
Surgery. It depends what it is, though.
Okay, I was gonna say no. You don't get to pick some easy mass removal surgeries.
Okay.
If you are gonna do a full day of surgery and you don't have to do appointments, and you have to do every kind of surgery.
No. Appointments. Faux show. I just like the break of surgery because it breaks up the monotony of like zigging in and out of exam rooms, and it's a different type of exhaustion.
It's a different kind of
surgery.
thinking.
Yes, exactly.
Yeah.
It's.
I actually
different.
think you can think about the cases when you're actually doing surgery. Like once you're doing surgery and it's kind of becoming like a normal like hand, you know what I mean? Thinking, I find it's like almost like a time of like, it's like a thinking time.
Yeah. And the conversations, like your interaction with people are a little different. So it kind of breaks that up too. And but if I don't get to pick and choose, then I would say appointments.
You should do surgery. You're more than... You don't like the
Smoke. What do you think?
You don't like to manage the complications posts, right?
Exactly.
With the more complicated ones.
Yeah, it's too stressful.
So
I gotta sleep at night.
Gotta sleep at night. I get that.
Yep.
So, Smokies, what?
I'd have to pick surgery probably, but I like them for different reasons. But I like how like my schedule: appointment day, surgery day, appointment day. So it's like alternating
back and forth.
Yeah. But I like surgery a lot. I just had a full surgery day.
You did. You did surgery all day today.
Yeah. So yeah.
How
I'm
you
not
feeling?
at the point yet where I can think about other things.
What?
But I'll get there hopefully.
Just takes practice.
That's right. Oh.
Yep.
Emily, what would you say?
I think I'm going to be team surgery.
Team
Just
surgery.
From my experience at humane societies and doing shelter surgery days, the day flies for me. So I think I'm excited to be able to get to do more.
More surgeries.
Yeah.
Yeah.
What would you pick?
I would surprisingly, well, it depends on like why you were picking. Like if like you were picking the day to make it easier or the day to make it more interesting.
Oh, okay.
Like I would,
So now you have to explain both. So
well, I mean, I would pick appointments if I wanted to, like this doesn't sound right. Easy is not the right word. If I didn't want to have to worry.
okay.
I would pick surgery if I wanted to have fun.
Okay. Okay.
So
I'm not surprised. That's kind of what I would think.
Yeah.
For you.
Yep, that's it.
Okay. It's a good question.
Good question.
That was a good one. Number 2, would you rather swim in a tank of cockroaches or a tank of snakes? This is the first time reading it. Or a tank of snakes. Emily?
So the tank's like fully that animal,
Does not specify.
or
So I
are
guess
we like
yes.
in a pool with that animal?
Oh, I'm thinking it's a full of
It's
them.
Yeah,
full.
that's what
We're
I
going
was
fear
thinking.
factor.
Yeah,
It's
fear.
full.
That's exactly what I thought of when I read the question. I was like, this is totally fear factor.
Yeah.
Then cockroaches.
What kind of snakes are they? Are they poisonous? Are we going to die?
My thing, even though, is if it's a full pool of snakes, then you're gonna end
Yeah.
up stepping on them and everything. If you step on a cockroach and it gets pissed off, it's
Yeah.
whatever.
Yeah.
If you
Or
step on a
or it
snake
dies.
and make it mad, then even if it's not poisonous, I don't want to have to deal with a mad snake at me.
I'm
Or it's
cockroach. I'm team cockroach
Yeah.
too.
I agree.
Me too.
We're all cockroaches.
Yeah, this is dumb question. Moving on.
Would you rather go swimming with dolphins or whales?
You go first.
I'd say dolphins.
Yeah. Are you a marine person?
I know.
You wanted to do marine biology,
Yes.
medicine, or whatever.
That is true. Yes. Yep. I would say, yeah, at least I have a shot of staying alive.
Yeah.
Possibly.
I agree. Dolphins, boat show.
Yeah.
Yeah.
I'll do whale watching on a boat.
Yes.
Yes.
Swim with the dolphins.
Swim
Even
with the
that
dolphins.
is so, they're so big and creepy and mysterious.
It's the only way they're living is because they are in water. Like they're just way too much.
Whales.
Yeah.
It's just too much.
Their little frames wouldn't be able to hold up their bodies.
Little frames for whales?
Like they're skeletons. They're little
know.
skeletons. Are really
I don't know. Have you
little.
ever gone to a museum with
The
skeleton
skeletons
of
are
a
not
whale?
big of a whale.
What?
I didn't know that.
What about a killer whale?
It's like when all the dead whales wash up, why it looks so weird. And
They're just
everything.
not, they don't. So, I mean, like if you put that whole body onto it, they wouldn't be able to survive. Not to mention they can't breathe. But I mean, if they had to walk, like, to,
Wow.
Can you imagine something?
Well, they can't walk. We're really getting to the nitty gritty here. I'm like,
I'm just
they
thinking,
don't have
this is what I'm thinking. I'm really hungry. But I'm thinking that it's amazing. God has made them for the ocean. There you go.
Who would have thought?
Who would have thought? They're not supposed to be anywhere else. That's
Now I
why
need
they
to go
can weigh that
research.
much and have those tiny skeletons.
I need to research tiny skeletons,
Yeah.
I guess. Like, this is
I mean, okay,
anything.
you're not going to like find a skeleton like this big. I'm saying for their body mass, you're going to be like, wow, that's not that much skeleton.
It's just not something I
I
thought
thought
about.
Okay,
I've
fair
seen a lot
enough.
of dead whales. So.
On to case collections.
Wow. Okay. Who wants to go first?
What's your case?
Okay, I'll go first.
You
Okay.
go first.
So I've got a 1-year-old Cavapoo. Yes, it's a Cavapoo. So that's a Cavalier and a Poodle. She presented last year for her routine spay, no issues on blood work. She had low platelets, and then we verified it under the microscope. So we halted the surgery, postponed it, sent out basically a confirmatory test, and they were low. So we discussed potential causes, immune-mediated, tick-borne, blah, blah, blah. Gave her just a trial of Doxy. I think it was 2 to 3 weeks, and her platelets rebounded. She was doing fine, so we spayed her. Fast forward to this year, actually, she had an episode of gastroenteritis and just bad bloody stool. So knowing her history, we checked the labs and her platelets were low, but not like immune-mediated low, where they get to the point where you're worried like they're going to bleed out, less than, I don't know, they're like 20,000,
Yeah.
30,000, whatever. And so we sent it out and it was confirmed low, but I think it was like 90,000. So it was like, okay, is this her? So then did some like looking into options of what it is. And Cavaliers come with a genetic mutation. So it is basically congenital macrothrombocytopenia. So they produce large platelets, and it's just how they're being produced. So they're large, meaning the count will be lower, and it does not cause clinical bleeding. At the time, she was having bloody diarrhea, so I didn't know which one it was. So we treated her. She responded and rechecked, and her platelets were still low. But they make notation. It's like some large platelets were there. Consider this. So we did the genetic test and sent it to Auburn, which is the place that does it, and she was positive for it. She carries it. So she's not – there was only 1 point mutation of the X. There was only one X affected, not both X's affected, because she's a female. So – that's why we're seeing that, but she's not like severely affected or something like that.
Very cool.
Oh,
Did you
yeah.
write that on the wall? Because I mean, I know although it's like not, it's not
It's like
uncommon.
a thing you
it's
look
not,
for, but we don't
right.
test
Mhm.
for it really.
Right. We never get a test for it.
So I will. I'll put it on the wall.
That's a good one.
Nice.
Very
And
cool.
she's back to being fine. So we now know it's her. We don't have to freak out every time she's bleeding. So
Very cool.
Cool.
The machines can't read the platelet size,
uh-huh.
so they get counted as something else.
Yeah, we have to look under the microscope essentially.
Mm-hmm. Yeah. Very cool.
Yeah.
Cool.
Smokies, you want to go next?
Sure. I don't think I talked about my API dog on the podcast. I don't think I have.
I don't think I.
Okay, so this was cool because it was my first time experiencing it or seeing it or diagnosing it. But I had a 1-year-old male German Shepherd that came in, new client, and the dog had a history of diarrhea, chronic, and weight loss. And so the owner had been through testing prior to coming here, and was kind of just frustrated with the ongoing weight loss and things like that. So we ended up doing a gastrointestinal panel to look more specifically at GI health. It's a little bit more in depth than our typical blood work panel, and ended up coming back with a low value that supports exocrine pancreatic insufficiency. So it was nice because I had an answer for him. We started supplementing pancreatic enzymes, and he's doing great. Gained weight, so we're
Nice.
just monitoring him. Diarrhea stopped. So
And now
yeah.
the owner's happy.
Owner's happy.
Dog's happy.
Yeah, lifelong treatment, but it's a good outcome for the dog.
Have you guys been hearing those commercials for people with EPI?
No.
Mm-mm.
No, you haven't? Have
Yes.
you heard? I feel like they're on the radio all the time now.
What?
Yeah. And
Is
it's
this like a new thing in human medicine or?
No, it's been around. I don't know
Okay.
why they're advertising for it.
Huh.
But did you, when you were just, I don't think, did you tell people what it is? What EPI, like what?
What that means. So basically,
You said exocrine pancreatic insufficiency, but kind of describe like what it is.
Yeah. So it's decreased production or excretion of pancreatic enzymes into the gastrointestinal tract. So basically, digestion's not as efficient, has a hard time just absorbing nutrients, things like that. So common clinical signs of that are weight loss, diarrhea, gastrointestinal issues.
And German Shepherds are
Mm-hmm. One of the most common
breeds.
breeds.
Yeah. Very cool.
And I always remember too, well, German Shepherd, of course, but then they're still really hungry, but they keep losing weight.
Mm-hmm.
I always think that's
Voracious eaters, yeah.
Yeah.
But starving, basically.
Yeah.
Starving.
They are.
I mean, that's what's happening.
Their body is starving.
Yeah. Emily, did you pick a case?
Yeah, so the other week we had a Great Dane come in for emergency surgery, and it was suspected foreign body. They knew what it had supposedly eaten and everything, which was a belt. And it was interesting because once we got into surgery, there was nothing to be found, but it looked like the dog's stomach was actually in the process of developing a GDV, or bloat. So that was the earliest I've ever seen bloat, especially under surgery, and to be able to catch it in the process. And then also it was interesting because, you know, a foreign body was suspected, and it completely ended up not having eaten anything, and somehow just worked out perfectly that they lost their belt while this dog started dealing with bloat.
Lucky.
That's
Yeah.
fascinating. I didn't know that's how that ended up. Do we pexy him, I'm assuming?
Yes,
That
he
one?
did get pexied.
Wow.
Yeah.
Good look right there.
Yeah, no kidding.
That is, yeah, no kidding.
It did
That's
not flip yet.
That is interesting because I think that brings up a good point that animals will come in for one reason and it's not really the primary problem. Like they're coming in because like for instance, I had a dog who came in and had a lesion on his nose that was ringworm, but on its physical exam, we found a mast cell tumor. So it's like, oh, okay, I'm glad this brought you in. You wouldn't have come in without having had that, and so it's like over and over again that happens where
That's
it's
why you
like,
do full physical exam.
yep,
Yes.
I remember the one came in for an ear infection. You found lymphoma.
yep.
Wow.
Young dog.
Yeah, and they
Those
weren't
were huge.
aware of it, but I was doing, and you could just,
Yeah.
it was like, oh, have you noticed? And it wasn't like they weren't huge yet, but
Yeah.
I mean, it's just, it happens, I feel like so frequently.
Mm-hmm.
Because they can't talk to us. So you just
Yeah.
go searching.
Yep. So anyway, very fascinating.
Yeah. What's your case?
My case is the case I worked on yesterday that was a referral from VCA for a surgical intervention for pyometra, which is a uterine infection.
Nice.
So the dog came in, presented at VCA the night before for classic signs of pyometra. So it actually was an open pyometra, which meant that there was discharge from the vulva. So the dog wasn't as critical, although she didn't feel great, that's for sure. But all of her lab work looked okay.
That's good.
And then they said, they give him an estimate. And it was too much. And so then they referred him over here and we did it then the next day. With it being an open pyometra, they felt they could wait till the next day.
Nice.
So we brought her in and did surgery. What was interesting about the case, which I'm assuming this is what was going on. So on my physical exam, the dog had uveitis. So scleritis and squinting, and so but was bilateral.
Mm-hmm.
So I mean, I'm assuming it was related to the systemic inflammation with the pyometra,
Oh.
but I haven't really seen that like those two things together or
Yeah.
whatever. So I'm going to see if it resolves after treating the pyometra. And
You.
so she was way more comfortable even after the fluids, pain meds, like that evening and then into this morning. Like she wasn't doing the like light sensitivity squinting thing.
Nice. That's
So
good.
Interesting.
Oh, that's fascinating.
yeah, so we'll see. I don't know. When we recheck her at suture removal, we'll see. I didn't treat her with anything topically just because I was treating her with other stuff, and she didn't seem that miserable. So I don't know. We'll see if should have possibly done like topical steroid, but I didn't. So anyway,
Yeah,
so we did
that's
surgery
interesting.
and removed the uterus. We spayed the dog, basically, for all those folks out there.
And it was a big one.
And it was a
Yes.
big one.
Yep.
And then we removed it, and she'll move on her way and
Live a happy life.
live a happy life.
Saving lives.
I'd say the most common things we see with those dogs, with the intact females, you're always going to get a pyometra at some point,
Yep.
or mammary cancer. I feel like you're always going to end up taking off a mammary tumor, or they're going to have pyometra.
Yep.
So it's just easier to spay them.
Yeah. Just get it done. Get it out of there.
Get it done. Get it out of there. Move on.
Not doing anyone any good.
Right. Oh gosh.
Okay, listener question. Hi.
That was really good.
Hi.
That was some good energy there.
As I prepare to start veterinary school at WSU, what is the best advice you could give to a baby vet student? At Grace Devos number 7.
Oh, where to
I
start?
read that. I was like, okay, buckle up. We're gonna be here a
Now,
while.
here's the deal. This is very interesting because Harrison put together a group of us that are all different phases of
I
our.
was gonna say that.
You were gonna say that? Oh my gosh! Good job. Okay,
Yes.
so it's interesting. So me, I'm ancient. Then you have Duckwall, who's
Second ancient.
so third year now.
Yeah, third year.
Emily's in school,
Yes.
third year in school,
Yes.
right? And then Smokey now you're about a year.
Mm-hmm.
You're
Oh my
seasoned at this point.
God.
So weathered and torn.
fun.
Okay, so there's so many different facets to this question.
I know. This is so fun. Wow.
Okay,
Who wants
so
to start?
you start.
No, let's let them start.
Okay, so from a veterinary student perspective, this
Yes.
person's starting veterinary school. You are the closest to that. So what do you think what are some of the most important things they should keep in mind when they get ready to start their first semester?
Hmm.
I would say a very big thing for me was finding a study group. Because I know all of undergrad, all of my whole life pretty much, I only did things on my own. But I felt it can be very beneficial to just have people, even if it's not consistently, just if you need to be able to really talk things out and go through situations, go through what you're trying to learn in different topics.
Mm-hmm.
And especially with the amount of material you are now being asked to study and then be tested on, it's just so beneficial to really get that good conversation.
I like that idea. That's a good idea.
I agree with that one. Study groups are the way to survive.
Yeah, because somebody will understand the process. Especially if you're talking about like pathways and like, it's like, I don't get this one. Then one person understands it very clearly. And
Yeah.
so then can explain it to.
And it can even just be beneficial because even as vet students entering first year, you still all have different backgrounds and different life experiences. And so I'm one of the youngest in my class. And so then compared to some of my friends who are in their 30s and whatnot and maybe worked as a tech for 10 years before coming to vet school, they can tell me, oh, well, I once saw this and I can learn from that. And so everyone's experiences can come together, whether it be small animal, large animal, exotics. And it's good to just be able to learn from each other and also help each other out with your strengths and then get that advice and get that assistance with any of your weaknesses.
Yeah.
Mm-hmm.
Yep. Just quizzing each other too.
Mm-hmm.
Yeah.
Constantly asking questions, using study guides.
Yes. Break up the work a little
Yes. Yeah. Lighten the load.
bit.
For sure.
Yeah, that's a good one.
Smoke, what do you got?
Yeah, I was going to say she's already tackled one of the hardest parts, which is getting into vet school. So congrats to her.
Yeah, absolutely.
Yeah. So I feel like, what is the analogy they use? You're drinking from a fire hose.
Yeah.
Which I definitely felt at times. It's a lot of information and it depends on which vet school you go to. But usually it's like year one is you're just learning anatomy and physics and like the normal things. And then year 2 gets into the diseases and year 3 gets into more of the diseases and year 4 is like hands-on clinical. So year 1, it's hard to remember. It was a blur. It was a long time ago, I feel like. But I think just try out different study techniques to see what works, because it's definitely a whole different ballpark compared to undergrad. So for me, it really helped to like quiz myself. So that just worked for me. But for some people, like study groups works. And I leaned on my core group of friends, and I had one roommate. We lived together for 3 years, and we were like always together. We always studied together, and we studied separately, but we definitely had that support. So I think the support either from like family, friends is huge, and having them to go to. It's a stressful time, but it has an end date, so you can get through it. And I would also rely on professors a lot, because they ultimately want you to succeed. So, you know, going into their office to talk about something and asking for study tips, and they're like usually more than willing to help. So yeah, that's what I would say.
That's good.
Yeah, I think that's a good point. Like your study technique might completely change because of the material is just so much and so different too, that maybe it's not the same method anymore. I would say just have a way to also take a step away from vet school, because it's so all consuming, that like have a plan to where you know your limit. Your brain can literally only pack so much in a certain time of studying. So like, don't be afraid to step away, take a break, take a nap, go on a run, things like that. Just figure out ways that help you just relax and rejuvenate. So then you are more ready to go back to the studying and stuff, because that's really what vet school is. You're studying all the time. There's just so much information. So you just have to have that balance, because you can get burnt out in school just as much as in real life. So having boundaries and being okay with setting those from the start is going to make it easier down the road when you have more distractions or more things to tackle. So a plan. It may not go according to what you think, but at least you have some ways to get out of the school fog, study fog.
And being able to step away often ends up helping people's grades too.
Yeah.
When you don't force yourself in the room for 6 hours and let your brain take that break, it really retains more.
If you don't work out in the mornings now, start. So you start a habit.
Oh gosh.
Or at the end of the day, whatever you prefer.
Yes. I would say there are a couple of things, and this comes from being old. I would say don't take yourself too seriously. Number one. Don't give a rat's ass about your grades, really, because it doesn't matter in the end. Really, what matters is your understanding of the information. So don't get wrapped up into whether you have an A, a B, or a C. There's that whole saying about like A students do this, B, I don't know, C students, most veterinarians are C, I don't know, something like that when you graduate or whatever. No one asks what your grades are. Did I ask any of you guys what your no one cares. So don't worry about the grade as much as, do you know the information? That's way more important.
And don't compare your grades either.
And don't compare your grades, because it does not matter. Yeah. Absolutely. And I would say don't be afraid to ask a question in a room when you do not know, and it's just so much easier just ask the question then, instead of having to track the professor down later, or whatever. There's going to be somebody else in that room that has the same question.
Yep.
Even if it's a stupid question. And I asked a lot of them when I was in school. Yeah.
But they're not stupid. It's all so
I know there are some definitely stupid questions. So like my stupid question was, what is a ruminant? So like you're in veterinary school. I had never worked around cows. I was going to school to be a marine mammal, person. Did not know what a ruminant was. And so I was like, they were talking about ruminants. Everybody knew what a ruminant. I was like, what the? So I was like, what is a ruminant? And then they told me, and then I was like, okay, I get it now. And they're just like, So anyway, and I'm in Tennessee, of course, where it's all rural farm. Anyway, whatever. But the point is, nothing bad happened to me. I didn't get struck down by lightning or anything like that. So ask those questions, even if later you're like, that was stupid. Yes, it probably was, but who cares?
Yes. Don't care what other people think.
Yes.
Yeah. And really just enjoy it, because, you have the rest of your life to work. So just enjoy being there, enjoy the camaraderie, enjoy, all the things that you're learning. And would say the other thing would be if you don't have to track. I don't know how you guys feel about that, but I would say don't track. Like, I feel like my education was much more well-rounded from the standpoint of stress and anxiety and just learning other approaches, because I learned large animal and small animal. So I get the pros of doing tracking and only doing small animal, but I really think that you can learn a lot of other things that you can extrapolate to small animal by being around large animal. And so, and plus it gets you out of small animal, and kind of like that, there's just different demeanors, right? With the professors and small animal versus large animal. And so being around those guys that are large animal guys and seeing how they interact. Well, I was around guys. I mean, I had like maybe one female teacher, but that was in large animal, but they were very go with the flow. Like, it's all going to work out. Like, you know, and so it got you to be able to be like, oh, okay, you saw this other side of veterinary medicine. It wasn't all just like, you know, kind of a thing. I don't know. Is that what you guys thought was small animal? I mean, it's like they were very like, I had a couple of really people that were, you know, really chill people, but a lot of them were like, tie your knot this way, don't do it that way. I'm going to smack me your face. Yeah, I'm going to, you know. It's like, oh my gosh, you know? So now maybe they changed. And
I don't know. I would say I agree. Like, just the different, you get more diversity. You get to break up that, that constant monotony of, I don't know what I'm trying to say. But yes, you can break it up and stuff. And like, you find maybe some things that you think are really interesting too, that you'll just be like,
never knew.
Maybe I'll use it down the road in life or something. And I think it's important tracking. I like tracking if you're pretty confident of where you want to track.
Sure.
If you don't, then I think it makes sense to explore everything, because you never know what you're going to like.
Yeah.
So I guess it just depends. And if there's like, if you have to decide and you're like, I have no idea, then do everything and just figure it out that way and get exposure.
Yep. Yeah.
But I will be honest, I'm very happy because I tracked, and at Purdue I did companion, so small animal and equine only. I didn't have to worry about the stupid ruminants and cows and pigs. When we got in those classes, I hated it. Yeah. I hated it. It was boring. I didn't like it. It was not interesting. It was like, I wouldn't want to do work on that 4th year clinically because I have no interest. Like,
oh yeah. So we had to do all clinic. We had to do large animal clinics, but it was some of the best memories I have were in those trucks going to the prison where we serviced all the cows and like just, you know, working on the herds and like just being outside and doing some of that work, and some of the scariest work with the horse that was going towards the river that I had to hold on to. Like,
I prefer the large cats, not small horses.
So, I mean, like, there's some really, anyway, but I agree with you. I think if you know, it certainly gives you an opportunity to fine tune your education. I think the other thing is you will not just, there's a couple of other things now that I think about it.
Right. I know I got some too. I'm like, hang on.
You'll make it. Like, just already know you're going to make it. So like, don't even think about whether or not you're going to make it. Like, that's just like an assumed thing. The college, the professors, nobody wants anybody to fail. So you're going to make it. Just keep working. The other thing is, what was I going to say was the other thing? You go first, because there was something else I was going to say besides assume that you're going to make it. I was just
going to say be open. Like, you go into it and you're like, I'm going to do this, because you want to be a vet your whole life usually. So then you go into it and you're like pretty rigid on things you enjoy or think you know and blah, blah, blah. So it was going along with the tracking. And stuff.
I know what it was. You're not going to know everything when you graduate. You will not have learned everything you need to know in order to work. So don't think that either. It's not going. You will not know everything. No
matter how hard you study, it don't matter.
So
it don't matter.
There's so much learning that happens after you get out, and that's just the way it's designed. The way the system is designed right now. I think they're make some changes, and you can speak to that with your education right now and how they're kind of doing things a little bit differently at your school. But I think that's just the way it goes. It's just impossible to expose you.
I think it's literally 80-20. Like 80% was after I got out of school and you're hands-on. Yeah. It's insane how much you grow.
But you do have to find a clinic that has a Dr. King.
Yes.
You need I don't know about that. You just need to find a clinic that has veterinarians like you guys. Like, I think all of us.
Stop. No, you stop.
Okay. So I think that
mentor good people.
Yes. I think that's important.
Yes.
For sure.
Yeah.
Talk about how they're structuring your school.
So
your schooling.
I go to Lincoln Memorial University, which is located in Tennessee. And a big thing that we do different compared to a lot of the vet schools around now is we actually don't have a teaching hospital. So we do clinical rotations, and it's 11 months of rotation over a 12-month period, including a NAVLE study block that they allow us to take. And we pretty much spend each month at a different clinical affiliate. And so you get to apply for what affiliates you want to do as a overall. So some people pretty much stay in the same area and live in one house for the whole year. Other people decide to travel the entire country and really just make it a year of travel and road trips.
Mm-hmm.
But it's because we don't track either, which I personally have enjoyed the experience of not tracking. I feel like it's kept me a bit more open-minded to everything, but it allows for people to kind of start using clinical affiliates to dive into where they think they're going to go. And even then, I know they've told us sometimes they have people call and their clinical year's all planned out and they're like, get me out of equine. This is not happening.
Mm-hmm.
And so then they completely will help rework it, rechange it. But yeah, I think they had decided to do that route and not build a teaching hospital just because they wanted to make sure any veterinarians that are graduating didn't feel like they were only seeing kind of like the zebra cases at a specialty hospital or whatnot.
Mm-hmm.
And they wanted to make sure they were seeing more of just the typical GP. They weren't graduating and seeing a healthy puppy for the first time. They were truly getting that hands-on experience at different clinics and
Mm-hmm.
getting good clinical experience.
Yeah.
Yeah, makes sense.
Cool.
Purdue's done some things differently, like than say Tennessee, like where they have the companion
Mm-hmm.
services. Like you can go see a puppy. Like, do you know what I'm saying? Like you can rotate right
Mm-hmm.
through a service, like where you see routine stuff.
It's like community practice.
Community
I think
practice,
is-
or something.
I think
Yeah.
so.
Like we didn't have any of that at Tennessee. Like you didn't do it. Was basically all zebras. Like
Yeah.
I never saw a puppy. I didn't even know how to vaccinate a dog. Like, they're, I think, assuming to some degree you've worked in veterinary practices over time. So before you apply to veterinary school, which I had not. So you have seen that. So I guess your exposure, they're anticipating that you've been exposed to those things. But I think that that's, really helpful to see those things.
Yeah, absolutely. I think that's smart.
Yeah.
Especially, I think it is just slightly different when you job shadowed or whatnot and saw those things versus actually being in the position where you're about to be the doctor. You're going to be in charge of those things.
Mm-hmm.
It's just a bit of a different mentality. And
Yeah.
now you almost feel like you have to have all the answers compared to if you're job shadowing. You may be paying attention to everything, but you don't have the vet school knowledge yet. You don't have just all that behind you to be in that position.
Yeah.
Yeah.
Very cool.
Makes sense.
What else? What else are we missing?
I want to go back on Dr. King. You said something about don't compare yourself to other people.
Yes.
And I know for me, a big thing, it's a phrase that I hadn't heard about, but I think we've all experienced it, imposter syndrome.
Oh, yeah.
Congratulations again on getting in. Know that you were accepted. They want you. You belong there.
Yeah.
Even though I will admit, at times you question if that acceptance was supposed to be for you,
Mhm.
and if you're cut out for this. And it can be really hard to not compare yourself to other people and not expect to or feel like you should have all the answers the second you graduate.
Yeah.
It's real. It's a
Yeah.
real thing.
Mm-hmm.
What else? Anybody have any other thoughts?
I think the thing that my mentor told me going into vet school, he was honestly like, don't do it if you're not 110% committed. He's like, seriously, don't do it. And at first I didn't understand why that would be the encouragement.
Right.
But it makes sense because you get so far in invested that,
Yeah.
I mean, Yeah, and if you start and you realize you're not 110% or 100% in, that's fine. Like, it's not a big deal. But keep that in mind.
Yeah.
Yes.
But if you are, it's rewarding.
Because I'd say the majority of veterinarians are happy that they became veterinarians. I think that some of them are dissatisfied with the industry to some degree, but I mean, I think that the veterinary industry in general is slow to change. But I mean, I think that they are looking at ways to make the situation better.
Right.
For folks, I mean, they see the problems that are out there, the people that go into equine, they leave after 5 years, I mean, there's a lot of things like that they know are there. I don't know if they know how to fix them yet. You know what I mean?
Yeah.
But
because they've been there, they're acknowledged and they've been there. We get talked about it in school.
Yeah.
So it's somewhere along that line, something's not changing.
Right.
So I don't know.
Very cool. It's a start of a new journey.
A little baby.
I know.
Oh my gosh.
A great question, though.
Yeah, it was.
Yeah.
So
It was fun. It was
thanks
different.
for reaching out and asking it.
Thank you, Grace.
Yeah.
Absolutely. Great idea, Harrison.
Great
After your
idea,
first semester.
Harrison.
Yeah. So after your first semester, do we have a first? We don't have a first name. We just have.
I'm
I'm gonna
assuming
assume it's
it's
Grace. So
Grace.
okay, yes, Grace. Okay, here's your invitation to be on the podcast. Once you get to school, you get going, you get settled in, and you maybe after your first month of class, then
give her a semester.
okay, after your first semester of class, then reach out to us and we'll have you on the podcast. You can tell us what you think and where we missed,
Yes.
Yeah.
where we didn't hit it.
I want to know what she's interested in.
Oh yeah,
Oh, that's
Small
true.
animal? What
Yeah.
does she like?
mixed practice, large animal.
Yep.
So yeah,
That's a great
best of
idea.
luck. Get
Best of
excited. It's a journey. It's a lot of fun. But
A
like
new
I said,
door has opened.
new door is open,
Yes.
baby. That's right.
Wow.
So and
Welcome to the cool club.
Yeah.
All the cool people are becoming vets.
oh gosh, oh jeez. But yeah, and then we'll have you on the podcast, and that'll be
Great.
fun. That sounds awesome.
That's cool.
Okay.
Okay.
Oh, is that a wrap?
Everyone I was going to say, is everyone happy with their answers?
I think so.
Yeah.
Okay.
Anybody have anything else to add?
I'll think of something like 2 hours.
Yeah.
I know, right?
As you're trying to fall asleep.
Yeah,
Till
exactly.
tomorrow.
Yeah, and Grace, if you have any other follow-up questions, shoot them over. We'll be
Yeah.
happy to answer them.
Yep.
What's
So,
up?
okay.
Okay. Outro.
Outro. Well, you got first of all, Emily, thanks for joining us.
Oh, yes,
and
thank
and
you.
offering your perspective as a student. I appreciate it. And Schmoke, as always,
Yes. As always.
you're the bomb.
And best of luck on finishing school. 'Cause
Thank
you're
you.
You're almost to the end. So.
Yes.
Almost.
Can't wait for that day.
That's right. Exactly. Then the real fun begins.
Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
See ya. Bye.
See ya! Bye!